This is my first webcam video for YouTube, and you're watching the Road Back 85 channel. This first YouTube video, I'm essentially going to cover some basics on what SSRI drugs can do, as well as DRIs. SSRIs are selective serotonin reuptake inhibitors, and DRIs are dopamine reuptake inhibitor drugs. They are both classes of pharmaceuticals, essentially try to calm individuals down who have mood problems, or they are severely depressed, or they have hyperactivity issues. These types of drugs can be very dangerous because they can cause mucosal lining damage. Specifically, dopamine reuptake inhibitors, a drug called Wellbutrin, has a class of its own generics, and as we all know, or most of us know, generic drugs can be very deadly, as well as the actual label drug itself. However, Wellbutrin generics, such as bupropion, it's by Teva Pharmaceuticals, can cause mucosal lining damage, which is essentially gastritis or duodenitis, and it can cause that in just a few days. The drug can also cause gastric polyps to form in just a couple of days. Then you are caught into what I call the protonics nightmare, because you need a powerful proton pump inhibitor, which eliminates acid up to 99%, to heal some of the mucosal damage. And the mucosal damage, those of you who have had gastritis or duodenitis or any other type of intestinal inflammation, you know you are very sick, usually vomiting, sometimes to the severe case, constantly feeling nauseous, having stomach pains, etc. Everyone is different, however, we're all the same, but these things do affect everyone differently to the degree of the damage is done by dopamine reuptake inhibitors. SSRIs, selective serotonin reuptake inhibitors, basically can make you gain severe weight, causing a reflux type of problem, and this might make you run to the doctor thinking you have a problem when in fact the drug actually has made you want to eat more and more because of what it does to your hypothalamus. And your hypothalamus is something that controls a lot of things, including eating patterns. And the example that I'm going to give is there's a man on YouTube that had a brain tumor, and it was pushing on his hypothalamus, and he was gaining weight. He was several hundred pounds overweight. He was over 500 pounds. And glutathione, which they can give intravenously, like a glutathione or a cocktail of vitamins, vitamin infusion therapies, things like that, were making it shrink. Specifically the glutathione he was getting maybe twice a month, I believe, and it was shrinking his tumor, and he was not craving as much food. So the same thing applies to the brain tumor, that these medications, dopamine reuptake inhibitors, as well as selective serotonin reuptake inhibitors, these different types of drugs like Lexapro, Celexa, Zoloft, those are SSRIs. And then you can have, of course, the Wellbutrin type drug, which are dopamine reuptake inhibitors. But either way, these drugs lead you down a path of digestive health failure or chronic disease, because they're messing with your brain and your gut, and everything is started with a psychiatric drug when most people just need to learn how to try and figure out different stress relieving techniques that are non-pharmaceuticals. You don't want to get into a nightmare because of a psychiatric drug. You don't want to get into severe GI problems. You need to eat to live, and without your digestive system working, you are having serious problems down the road for bad health continuously. That's all I'm going to say right now about Wellbutrin, the DRIs, and SSRIs. But be aware, most DRIs do cause mucosal lining damage, and then you will need to take Protonics for about 2 weeks at 40 milligrams a day. This concludes my first broadcast on the road back 85, and I'm not a doctor, a nurse, or medical practitioner, but I have been wronged extremely by medical malpractice, armchair diagnosis, and given medications I never needed. Thank you for watching.